My name is Naveen Rao, and I'm the lead of Merck for Mothers, Merck's 10-year, $500 million initiative to end preventable maternal deaths worldwide. In 2011, Merck for Mothers was launched at the United Nations to help create a world where no woman has to die giving life. To do that, we're bringing our scientific and business expertise to the global fight to help address this important issue. Our efforts are focused on three areas. One, equipping healthcare providers with the skills, tools, and technologies needed to deliver high-quality services wherever women seek care. Two, ensuring life-saving maternal health products are available to women and their providers. And three, empowering women to make informed choices to help ensure a healthy pregnancy and safe childbirth. Alongside more than 75 partners who are working on more than 50 programs in 30 countries, Merck for Mothers is helping pave a smoother path to safe motherhood for women around the world. Together, we've improved access to quality maternal health care and family planning services for nearly 6 million women around the world. What we've accomplished with our partners is inspiring, but there's still a lot more work to be done. There's an enormous opportunity as well as an imperative for us to leverage our resources and work together in new ways to save and improve millions of lives. We've decided to launch a new program in Alberta due to its large Aboriginal population and the unique challenges pregnant women face. Alberta is home to more than 220,000 people descended from the First Nations, Métis, and Inuit peoples, the third largest Aboriginal population in Canada. The deaths that occur in the weeks before or after a woman gives birth in Aboriginal women is much higher than the non-Aboriginal populations in Alberta. Poor reproductive outcomes for Aboriginal mothers have been associated with young maternal age, lower maternal education, low income, and inadequate prenatal care. Additionally, Aboriginal women in Alberta are more likely to be overweight, hypertensive, diabetic, or anemic. Merck for Mothers saw an opportunity to target the range of complex issues, from housing and food insecurity to education and cultural insensitivity that are oftentimes associated with the high maternal mortality rates among Aboriginal women. Merck for Mothers will support projects in 3 communities in Alberta: Meskwakis, a larger reserve located close to the urban areas; Little Red River Cree Nation, a small and remote community in the northern part of the province; and inner city Edmonton, where a large non-reserve population of pregnant women are homeless and living on the streets. Each community struggles to overcome barriers to improve maternal and child outcomes, including poverty, food insecurity, racism, discrimination, cultural insensitivity, domestic violence, addiction, homelessness, and stigmatization. By working closely with the communities and Aboriginal women, we hope to help Alberta Health Services develop and implement solutions that overcome these barriers and improve access and quality care for these women. We hope that our work in these 3 distinct geographical settings will enable the adoption of successful strategies among similar communities in Alberta and throughout Canada. Thank you and be well.
I'm Silka Janes Kelly, and I'm the site director here at the Royal Alexandra Hospital. Merck for Mothers set aside $500 million over a 10-year period to help women internationally to improve their health and their fetal newborn health. So here in Alberta, through our strategic clinical network, Maternal, Newborn, Youth and Child, we have applied for funding, and so Pregnancy Pathways was one of the successful projects that has been funded to the tune of around $128,000 per year for 3 years, and that will be contributing to what we call wraparound services for our women who we will be housing in the Pregnancy Pathways. Pregnancy Pathways is just one piece of the puzzle in the community. There are over 25 agencies that we have worked with around this project, and many of them already provide many wonderful services for these women. The one piece that everyone has identified as a gap is housing. And so to be able to have housing for our most vulnerable women with a harm reduction model will start that journey for all our agencies. They can all refer women to this, but it was the one gap identified by everyone that we needed more housing for this population.